I'm going to put you a little bit on the spot here. What are the top three most pressing social problems that the communities and individuals your organizations deal with are facing, if you had to rank them? And anyone can jump in.
I'll give you one.
Okay.
I think that the years of systemic oppression is probably the biggest contextual thing in my mind, because if we're just talking Chicago and we want to make it the most recent, if you look at the history of redlining in our city and the inability for mostly black but also brown people to not be able to benefit from one of the largest wealth generating mechanisms in the world, in the country at least, and for the United States, that has a generational effect in terms of accumulating wealth and then sustaining neighborhoods, attracting businesses, driving out poverty. It has an impact on education attainment. So I think that's the biggest thing I would say in terms of getting to the root.
As a matter of fact, I want to just contextualize something of what Vaughn has mentioned, right? Through Ready, we have a very small sample of individuals that we've been serving. So we've served roughly about 1,200 men through engagement of street outreach, but close to 700 of them, 680 so men, have taken advantage of the job and the CBT, some additional services along the way. But just to kind of give you a snapshot into what Vaughn is also pointing out here. So through police data, hospital data, we know that on average, our men in our program have 17 to 18 arrests. We know that 60% of them have done prison time. We know that over 80% of them have been victims of violence. Either they've been stabbed, shot, or assaulted. As a matter of fact, we talk about violence prevention, but ultimately, a lot of the men that we all work with here have been victims of violence, generally speaking. In Greater Chicago, we have had about 240 men out of the close to 680 men that I mentioned. They've been victims of shootings. They're survivors of gun violence. So that's 1/3 of the people that we serve. So again, building on what Vaughn just mentioned, I think about, one of the challenges for us is understanding that the oppression, the systemic challenges that we face today have been inherited, right, for many generations. And what we're seeing right now is a byproduct, right, of disinvestment, of lack of opportunity and access. So for your average listener who might say, well, so much money is going into violence prevention efforts, that is true, but there's way much more money going into punitive approaches as opposed to caring for people and fully grasping the fact that you are dealing with families who've been impacted by violence. You are dealing with families who have been separated because of the criminal justice system. To take, for example, the war on drugs. And there's other examples that I could give around that, right? But ultimately, our communities that we're working in right now, there's lack of opportunity for passive employment. There's actually lack of opportunities for upward mobility. We're seeing more and more residents in these communities leaving our city, which to me means also less taxpayers' dollars going into the system to support these kind of services as well. So again, there's a lot that could be deconstructed here, but I think that for your average audience, they have to understand that it's not just about, telling someone to put their gun down or providing a program for them, right? I heard Vaughn said this before. We're not going to be able to program our way out of the situation. There has to be implications around policy changes, removing stigmas and barriers, and really meeting the people where they're at and building from that point on.
Yeah, one of the ways we often talk about this is that we see it as a public health problem, not a crime problem. And as long as we see it only as a crime problem, we're going to continue to approach it the same way, which is to try and arrest our way out of the problem. And that hasn't worked, and it's not going to work. But what does work is when you start to look at all those root causes, as Vaughn mentioned, the structural racism that has denied wealth building opportunities in the African American community. It's denied entrepreneurship opportunities. It's resulted in less housing opportunities. It results in worse public health outcomes, actual health outcomes. There's so many implications of it. And when you really embrace all of those dimensions of an unhealthy community, you begin to understand why gun violence emerges as an outcome. And that's kind of the way more and more we're thinking about this. It's a public health issue.